Hi, Dr. Sasse here from Sasse Surgical. With so many people today with type 2 diabetes and pre-diabetes, and it's really tens of millions of Americans nowadays, over 30 million of us with type 2 diabetes and another 80 million with pre-diabetes, the question arises, is type 2 diabetes curable, or are we just consigned to having to manage the blood sugar number with medications, and sadly, ever-increasing medications? The definitive answer is that yes, it is curable in most people, especially if you are recently diagnosed with pre-diabetes or you're recently diagnosed with type 2 diabetes. Your focus should really be on trying to reverse the disease completely and not simply be happy with or settling for controlling the blood sugar number with medications. Why do I say that? Because the risks of continuing to just control the number put you on a risk at this level for all sorts of complications like blindness, kidney failure, amputations. But if you reverse the disease completely, then your risk is on this level. And that just gets wider and wider over time. So you want to be healthier, you want to live a longer life, you don't want to have an amputation or go into kidney failure. So what you want to do is focus on curing the type 2 diabetes. How do you go about that? This is a very personal disease. It has to do with your personal environment, your personal family history, and also your personal body mass index and your diet, your carbohydrate intake, and finally your exercise. So you heard me mention risk factors there. We can't really modify the risk factor of our family history, nor can we really modify the risk factor of our age, because this is an age-related disease, but we can definitely modify the risk factors of our carbohydrate intake, our weight, and our exercise. So the thing to do first is to focus on the things you can control and begin to hone in on goals for your daily carbohydrate intake, which is going to be lower than you've been used to, and your daily exercise output, which is going to be more than you're used to. The good news is the exercise can be moderate. It doesn't have to be really high intensity, and that helps a lot in building up the mitochondria, the little energy factories in our muscles that burn blood sugar and help us eliminate the diabetes and reverse it. For some people, that's not enough, and they're going to need metabolic surgery, which causes an internal change in the hormonal milieu that controls the body weight set point and causes hormonal changes that reset metabolism and blood sugar for a very long time. That combination of those personal changes with your diet, carb intake, exercise, and possibly with the aid of metabolic surgery, that combo is very powerful. Somewhere in the neighborhood of 80+% of people will see a total reversal of their diabetes, and they don't have it anymore. And then you got to work hard to keep it away. So is diabetes curable? Yes. Reversible? Yes. We call it a complete remission, and most of our patients achieve that. We actually try to avoid having all of our patients on chronic and ever increasing daily medications for their diabetes. So our view, aim for that cure, not just controlling the number. I hope that's helpful.